This is Rockin HIT Sales, a quick podcast built around the buyer side realities of healthcare. I'm David Hacker, your host and founder of Elevate HIT Sales. In each episode, I sit down with health system and health IT leaders to unpack what actually gets initiatives approved, implemented, and scaled. Today, I'm joined by Olga Maciejewski, an internationally recognized healthcare digital transformation leader and change management specialist, currently with Health Shared Services. This conversation is about why great health IT can still fail without great change management, and what vendors need to understand about people, process, sponsorship, workflow readiness, and adoption before they assume a successful sale will become a successful implementation. Hi, Olga. Welcome to Rockin HIT Sales Podcast. I sincerely appreciate your time to delve into the topic of change management today.
Yeah, thanks for having me.
So let's just jump right into change management. Why do you think so many digital health initiatives, they look really good and promising on paper, but they kind of struggle and can't grab traction when they hit the real workflows?
Yeah, so the main reason for that is that rarely organizations realize that the key to successful digital transformation is not really the technology, but people and process. And I have this high-tech prop here with me. So it's a diagram of a pyramid. So the top slice is the technology that we're trying to implement, but the two bottom slices is the people and process. So really, our focus in implementing anything needs to be on the bottom two, and technology will just come along.
Great, makes perfect sense. Now, change management is kind of a big buzzword. And so when health systems talk about change management, what does that really mean in practice beyond just your basic training and some communication? Can you elaborate on that, please?
Yeah, so there's a lot of components to change management. I sort of split it in two buckets. So the first bucket is related to sponsorship and leadership. So we need to have clear governance, clear decision-making processes, as well as leaders championing this change. And on the other hand, we also need effective stakeholder engagement. And we should also consider whether patients should be brought into the picture as one of the stakeholder groups. We need to spend time on process readiness and workflows, and of course, the communication.
Now, before a health system, before they roll out a new digital health tool, what really has to be true from the change management perspective?
Yeah, so I have my other high-tech prop here. So I refer to it like the success of the successful digital health transformation is really like a three-legged stool. So the minute you're missing one leg, it falls apart. So we are sort of traditionally used to having project management in place at this time. But then we still need two other legs, like I was mentioning, the sponsorship, which includes governance, decision making, and visible leadership, and the change management components that include stakeholder engagement, process readiness, and communication. So we have to have all three legs for the stool, the success to be successful, to stand.
Otherwise, the stool falls apart, right?
Absolutely, yeah.
So now you've mentioned sponsorship a couple of times just in our very short period so far. So what do you think about executive sponsorship versus the frontline ownership? And what happens when you have one, but you don't have the other?
Yeah, absolutely. So it is, well, in a way, those are the two like opposite legs of my stool here. So The executive sponsorship is one leg, and we have to have executives championing the change and the reason we need the change, and that all needs to be in place. But then we have on the other stool leg is the change management, and one of the items is stakeholder engagement, and that is that local ownership that you were referring to. So again, we need both legs for the stool to stand.
That makes perfect sense. Now, during the process, at what point do you feel that the clinicians or operational leaders and other end users need to be brought into this whole process of change, whatever that may be?
Yeah, so that can be scalable. So on this big project, this massive digital transformation I was involved in, we engaged everyone 12 months before the day of launching. And throughout those months, we worked through the stages of change. So it all started with a big kickoff and letting people know, why are we changing? Why do we need it? And we use patient stories as an effective technique to engage people with, why are we even doing it? So we've always had a patient representative share their story and their struggles and what they're hoping for will change with this new transformation. And then we worked through, the awareness, the knowledge, ability. So we talked about what will be happening throughout the months, registration for training, going through process changes that were applicable to this program or this area. And finally, 3 months before the actual date off was the most busy time, because that's where people would be completing their training in the clicks in the system training, as well as having all these last minute process change questions. There was all usually also conversion or cutover process just before going live. So 12 months on our scale was the period that worked for us. But of course, if we're working on something much smaller, things can be scaled and the period of time can be shorter. However, we should not be cutting out phases. Like, people still need to be involved in all the stages of change, and we still need to work through that.
Again, those, as you identified, those time period of those stages based upon the complexity of the transformation, maybe 3 months or maybe 1 month, just depending upon that complexity. Would that be fair?
Yeah, absolutely. Exactly.
But all the steps still need to be there, and that's great. Truly
Yeah.
understand that.
Yeah.
So now let's talk a little bit about adoption and from your perspective and from what you've seen, what usually separates a rollout, a new transformation that really gains adoption and gains traction versus one that maybe creates some friction or kind of quietly stalls and doesn't really get fully up to ramp speed?
Yeah, like if we did our due diligence with the people side of change, we engaged stakeholders in the whole process throughout the period. We worked through the changes. People are typically, excited and engaged with the process. Versus if we just skip that and focus on technology, then people are surprised and confused, and there is a lot of pushback. So the energy is very different, right?
Are there any common signs that when an implementation is live, but the change itself is not really grasping hold and taking hold? Are there any signs that you can kind of point to say we need to take a look at this?
Yeah. I would say that actually, like, no news is good news does not apply in that situation. So when people are working through a new process, new change, there's always some nuances. So they're asking questions, they're submitting tickets. If we hear nothing, that is suspicious. And also, we should have some mitigation strategies in place, like turning off legacy systems, right? So, not having people being able to access the legacy systems is one of the mitigation strategies. But people have they're strong in terms of finding workarounds and reverting back to old habits. So we need to be
Yeah.
mindful of what those were and how this looks like. And unfortunately, in this case, no news is good news. It does not apply.
When people put together big transformation programs, where do you see that they most often underestimate the efforts that is required around that workflow redesign, the training and the reinforcement and all the things that you've already discussed?
Yeah, exactly. So, in those phases of knowledge and ability, people really need to be supported with that, because even when they're on board with the change and they really want to change, they really need to know how, and they need to have the tools, and need to understand how their day-to-day activities will change. So it often boils down and to the nuances and to the details. And some areas that have more complex or more unique processes or workflows, especially when there is uh, integration with other areas that are more complex, do require more time from and more support in terms of preparation and mapping out all the steps and understanding how things will be changing.
Okay. And how should health systems think about balancing that the need for speed with the change load? And because especially right, these days, a lot of teams are kind of technology fatigued with all the new technology coming at them, and they just kind of are done with it, if you will.
Yeah, so it is a bit of a tricky question, right? But based on my experience, I would lean towards speed, and
Okay.
just getting it done quickly to maintain the momentum, maintain the excitement, sticking to like the 80-20 rule. We won't get it perfect the first time, but at least we'll have people using the new system, learning it, understanding it better, and we can go back and optimize it after we launch and make it smoother at that time. If we try to get everything perfect building to it without fully understanding the system and all the nuances and impacts it has on other teams, like it is very time consuming, and it's very easy to lose momentum and excitement.
And now, for all the digital health vendors that are out there that are listening to this, what's the most often misunderstood about change management that goes on inside a health system that they really should know about?
Well, yeah, I do go back to my diagram of a pyramid that vendors are familiar with the tip, the technology, but the trick is to understand the health system process and people, and work through supporting all that. Like, it's all connected. So that's the most tricky part, I would say.
When a vendor team comes in and gets involved with the implementation, what tends to create some avoidable friction during the rollout and that transformation?
Yeah, it's an interesting question. Well, based on my experience, like, vendors rarely know much about the client. So maybe
Okay.
we need to do a little bit more work um, in terms of like providing some sort of client one-on-one package to the vendor, in terms of like some basic understanding. Also, implementations differ if we're doing something just in one location for one specialty versus if it's a massive, everybody is going across the whole state or the whole province. So I think just having the basic facts about the client would would be helpful.
If a vendor, if they want to be seen and viewed as implementation ready, what do they need to bring in the table long before go live and primarily during the sales process? Is there something that says to you, these folks are implementation ready?
Yeah, I would say that honestly, like we need to all be working from this three-legged stool. Like the success is the stool that has three legs, and both
Mhm.
sides have to be mindful about each leg and what it entails. So the vendor needs to signal to the client, look, you really need to figure out sponsorship, you need to think about ABC, governance, decision making, championship, you need to think about change management. And the client, I don't know, I would almost recommend like they need to document it somehow, high level at least. So like to acknowledge that, well, yeah, we have considered all those things and we can put that together for this particular project with this particular vendor.
Now, once a project is live, what helps that improvement stick over time instead of just kind of fading away over the course of time? Well, I think we all have been there where something new is exciting, but 3, 4, 5, 6 months with that is people just kind of tend to go back to their old ways and put aside the transformation change.
Well, yeah, so we do need to have reinforcement strategy. So, first of all, there should be some strategies to like make it really, really hard for people to go back to their old ways. But another aspect would be to keep stakeholders engaged. And in my experience, having them engage with the continuous improvement of the system and how to make the change even better and more user friendly. That's the way to go. So establish some kind of ongoing continuous improvement framework that keeps the stakeholders engaged um, and that they feel heard.
All right, so we've come up to what I refer to my lightning wrap. It's the last two questions. It's kind of a rapid fire question, rapid fire response. So the first one is a complete this sentence. So Olga, if you could please complete this sentence. A digital health company is not ready to scale inside a health system until.
They understand the concept of the three-legged stool and they discuss with the client that really should be documented.
My final question is, what is one thing that digital health companies should do much earlier in the change effort than what they normally and usually do from your experience?
Well, the conversation about all three legs of the stool needs to be part of the process. Like I keep going back to it, but it's an easy concept. Hopefully, it sticks in people's head. Like you cannot have one without the other. It just falls apart, right? So it all has to be as a package. And I almost maybe would envision that there is a documented three-legged stool, all the components of it in maybe contractual documentation. So it is official, you know, like we're not just brushing it off. It is for real because that's what makes it successful.
I understand, and I agree 100%. When I talk with digital health companies, is whatever technology they're selling, that's not what they're selling. What they're selling is the change.
Absolutely, yeah, and hence maybe their proposals and their contractual documentation needs to include all the components, not just the technology is the tip of my little pyramid, right? And then we have the process and people is really what makes or breaks it.
Well, great. I really appreciate your time. It's a great conversation about change management, and I thank you very much. And I'm sure that our listeners, who are the health IT vendor companies out there and their investors, I'm sure that they're walking away with a much deeper understanding of what they need to make sure they have in place if they don't already from a change management perspective.
Yeah, thank you for having me.
Before we complete our change management episode, let's take a quick look at my three brief takeaways. One, technology is only the tip of the pyramid. The real work is people and process. If vendors only focus on the tool, they miss the part of transformation that determines whether adoption sticks. Successful change needs all three legs of the stool. Project management, executive sponsorship, and change management all have to be in place. If one leg is missing, the rollout, like the stool, starts to fall apart. Implementation readiness should start during the sales process. Vendors need to discuss sponsorship, governance, stakeholder engagement, workflow readiness, and reinforcement early in their engagement, not after the contract is signed. Have questions, comments, or guest ideas? Email me at podcast@elevate-hit-sales.com. Music is courtesy of Pennsylvania's finest, the Badleys. And with Oreo Speedwagon on the shirt today, here's my final note. If you want your digital health solution to stick, don't just keep pushing the technology. Build the sponsorship, engage the front line, and be ready to roll the changes because adoption is the real encore.